earned capital in the campaign, political capital, and now I intend to spend it.
You're listening to America's Healthcare Challenge with Sean McGuire on News Talk 1290. Join the conversation on Facebook at hashtag America's Healthcare Challenge or like our page at facebook.com/America's Healthcare Challenge.
Welcome back to America's Healthcare Challenge. Joining us now here on the program is John Turinas. After serving in the U.S. Marine Corps as an artillery company commander, John has worked as a journalist, entrepreneur, and business manager. He served 20 years as CEO of Wisconsin-based Serigraph, a graphic parts manufacturer with ownership in 10 plants in the United States, Mexico, China, and India. And he also continues to serve as the organization's chairman, but he's also the author of two really interesting books, The Grassroots Healthcare Revolution and The Company That Solved Healthcare. John, welcome to the show. Thank you so much for joining us here.
Hi, Sean. Glad to be with you.
Could you tell the audience a little bit more about your background and some of the things that you've been up to in healthcare over the past 10 years?
Sure. I turned the company over to my son as a CEO about 9 years ago, and I had to find something to do. And I was already engaged in trying to get the health costs at our company under control. We had about 800 people, and we were paying $5.5 million a year for health care, and it was going up 15% a year. So it was a big problem. So when I turned the company over and I moved from CEO up to chairman, I decided to take on this policy issue, both for Serigraph and then more broadly. So I've been working on it for about a dozen years.
Oh wow!
And I come at it. I guess the unique thing about where I'm coming from is sort of the voice you never hear, and that's the voice of the real payer.
Right.
So if you think about it, the real payer in this country is the private companies and their employees. About half the national health care bill is paid for in employer plans. So about half of it there, but the other half is paid for by taxes. And of course, all the taxes in the country come from private companies and their employees. So in effect, the private companies are paying 100% of the tab, $3.2 trillion tab in the United States for healthcare. So I just got real involved in it and started, just coming at it as a manager as opposed to a wonk or a politician or an insurance guy, one of the guys in the industry. We just started looking at it with managerial eyes versus in the industry eyes. Okay.
Right. So what were some of the things that you found as you dived into this issue? Was your organization self-insured?
We were self-insured going in. We did that about 20 years ago. So we were already underwriting our own risk. Obviously, whenever you underwrite risk, you got to manage the risk. So the first thing when I started diving in, I just started looking at prices. What's the stuff costing? And I was flabbergasted to find that the variation on prices for procedures generally was about 400%. I couldn't believe it.
Wow.
In my industry, I make auto parts I make the face of your instrument cluster, the speedometer gauge. So if I'm off by 4%, I lose the job. And this is a 400% variation. So for instance, you can pay $26,000 for hip in Milwaukee in the Milwaukee market, or you can pay $90,000. It's just crazy. And so I quickly, I've got a bit of a background in business and economics, and I just couldn't believe it. So I defined it as economic chaos, and that's what it is. So we set out to tame the beast, and and discovered some innovative managerial ways to do it.
What do you think about what's going on right now? Do you think it's to the point where people are going to be forced to have to start doing and thinking like this?
Yeah, and it is, as I suggest in my second book, I call it a revolution, a grassroots revolution. It is happening at private companies. 4 out of 5 private companies with more than 200 employees are now self-insured. So that's a huge change in the last dozen years. Before everybody would, they'd be in an insured program and they'd pay a premium. Well, all that's sort of gone. Basically, the health insurance companies are out of the risk underwriting business in the private sector. We're all self-insured, 4 out of 5 of us. So when you become self-insured, you're taking on the risk. I'm underwriting the risk. My company is underwriting its own risk. I gotta, like any other risk in the company, I gotta manage it. So that's increasingly happening in the private sector. So they're all moving to this away from what I call a busted business model on the economic side to a new business model, and that is it gets consumerism involved, it gets smart buying involved, it gets value-based outcomes involved, and we treat the industry like we treat any other vendor. You got to deliver good value at a good price, and if you don't, you're not going to be our vendor.
And you nailed it earlier. I think one of the reasons why is because there's just no transparency. Nobody knows what services cost. How do you think we can change that?
Well, I agree with your premise, first of all. I mean, I had a hip done, and I sat down with my CFO, and I'm a numbers guy. We couldn't figure out the bill. And I don't know how many CPAs I've talked to who nod their head, yes, they cannot understand their bills either. These are CPAs. So there have been, as you know, Sean, there's been some moves toward transparency. So it's getting better. If you really, really want to dig, you can probably find out the price of treatment. But you got to dig. And it's really hard for the average consumer to understand. So the silver bullet that we've discovered at Serigraph, my company, is what's called a bundled price.
Right.
So we have, we pay $26,000 for joint replacement. It's a single price, all in, fixed, no add-on, no balance billing, no follow-on bills. It's a single price. And in fact, it's even warranted. If there's a readmit, the readmission is on the provider, not on us. So they guarantee a $26,000 price. So we got about a dozen of those that we direct contracted at Serigraph. We saved $500,000 last year on a $7 million health bill.
Wow. Did you have
now there's a company in Wisconsin called Access Health Net that now has 1,200 bundled procedures, and they're going to market with 1,200 bundled procedures. So if you need a spinal epidural injection, they got a set fixed price for it, so you know exactly what you're paying. So finally, we have real transparency.
That's so interesting to hear, because that's one of the strategies that I talk about when I go speak with people out there. So it's really neat to hear that it's working. Did you have to go negotiate those deals yourself, or how did you make that happen?
Well, in the beginning, we were sort of the precursor of this thing. Yes, we just went out to these. By the way, we started with quality. So, for instance, one of our provider for joint replacements is the Orthopedic Hospital of Wisconsin, and it's strictly a bone shop. They don't take.
Sure.
If you've got a virus or some kind of bacterial problem, you're not going to be in that hospital. You'll be at a general hospital. So it's a bone shop, period. So it's a specialty hospital. Their infection rate is 0.2%. Last month, they were the number one ranked orthopedic shop in the country. So we start with quality, and then we negotiate a price. And, yeah, we just go direct contract. So this company in Milwaukee looked at that business model that we had developed in miniature at our company and said, hey, there's a broader business here. We can sell this to all kinds of companies. So they're out signing up providers for bundled prices all over the United States, and then they walk into self-insured companies and say, hey, it won't cost you anything. Just join our network, and we'll get a processing fee back from the provider. So anyway, so bundle prices are coming down. And you think I'm crazy and a voice in the wilderness? Medicare is already doing it.
Exactly, yeah. And the industry's going that way too. The insurance industry's copying Medicare.
Yeah, a little bit. The insurance companies always last to move, but Medicare is moving. CalPERS out in California that has 1.3 million members, and Advisor Healthcare is doing it. So they'll pay $30,000 for a hip and no more. So that's a bundle price expressed as a cap. So it's a maximum, but it is a bundle price, $30,000. If you want to pay more than $30,000, be my guest, but you're going to pay the difference. So bundle prices. So those are the two biggest buyers in the country, Medicare and CalPERS, and they're doing it. And now all kinds of private companies like mine are doing it. So it's a train roaring down the track.
How large of an organization do they have to be able to do something like this?
Well, the conventional wisdom, Sean, used to be you had to have 500 employees to self-insure, but that's totally out the window.
Sure.
Well, companies with as few as 10 employees are now self-insuring. So once you're self-insuring, you just sign up. Well, in this case, you sign up with Access, and you have the availability of 1,200 bundled procedures. So, for instance, a colonoscopy is $2,300. Well, hell, you can pay $9,000. No?
Mm-hmm. Exactly. Well, that bundled payment concept is a principle that both sides can agree on, and I think it's an appropriate time to take a time out. Can you join us for one more segment?
Sure.
All right, great. We want to get into how do we solve this problem, and I'm really looking forward to continuing the conversation with John Torinis, our special guest of the week here on America's Healthcare Challenge. Check out our Facebook page, facebook.com/America's Healthcare Challenge. We will put this interview up there as well as the latest news from the week. You can find it there. You can also find it on the Edie Bellis Twitter page, which is at America's Canary, because they are the canary in the coal mine with all of these massive changes in the healthcare and insurance industry. We'll be right back.
The way to make health insurance available to everyone is to lower the cost of health insurance, and that is what we are going to do.